Welcome to Dawn Dementia Care. This is the 5th class in the Dawn Dementia Care series on how to use the Dawn method to provide truly strength-based, person-centered dementia care. In this class, we'll look at the 2 very different approaches we can take when we're living and working with people who are experiencing dementia, and why the habilitative approach can change the care relationship from one of conflict and misunderstanding into companionship and less distress for both parties. From our previous classes, you know that there is good news about dementia, that although we lose some skills, we do not lose all our cognitive skills, and that we remain able to live in the present and enjoy beauty, music, feelings, and creativity, even though dementia is ongoing. And we know that the skills we do lose to dementia are very specific if we look at them from the perspective of function, rather than focusing on dementia medically, seeing only a disease and the changes people experience as being symptoms. We lose skills in attention management and language. These losses will affect our ability to hold a conversation, and so they affect all of our relationships and the way we interact with those around us. And we lose rational thinking skills, so our ability to use good judgment and make good decisions is affected. This impacts our ability to care for ourselves, to perform tasks, and keep ourselves safe. And finally, we lose not just our memories, but our memory skills. This means that we are only able to live and experience the present. This has the biggest impact of all, by far the most life-changing one, because our ability to recall what has just happened, or even happened long ago, changes our interpretation of what is going on around us in the present. Memory loss takes away the ability to perceive the present and reality in the same way as those around us. So, for example, if your mother is experiencing dementia and cannot recall her memories of your father's passing and his funeral, or her life on her own afterward, then each time she notices that he is not present, she will wonder where he is. Having memories of those events and earlier experiences would lead her to arrive at the right conclusion about his absence each time she thought about it. But without those memories, she will repeatedly arrive at the wrong conclusion, and if her family is upset by her questions, she will be upset too. She might feel angry that they seem evasive, or guilty about upsetting them, or afraid of what might have happened if her companions seem to be avoiding the topic. Yet if each time she asks they tell her that her husband has died and she believes them, they are causing her to experience grief afresh each time. When we are living and working with people who are experiencing the memory loss associated with dementia, we are constantly faced with their conflicting beliefs about what is true and real. Their ability to recognize reality becomes increasingly impaired. For most of us, most of the time our immediate knee-jerk reaction is to correct them. We contradict their erroneous beliefs and we explain what's true, and we redirect them, which puts us in a position of being instructive and their superiors. In the medical world, this is called reality orientation. It's taught to nurses and aides and is widely used in care facilities in the United States today. But most of us do it at home too. Why? I think the first reason is because correcting someone who is in error is something we do all the time, especially when we're raising children. When a child has misread a situation or drawn a wrong conclusion, we correct him. We explain why it's wrong. It's natural and usual in almost all social situations. And we do it because we value integrity and truth. We believe in the universal application of thou shalt not lie. And yet, do we really? We don't always tell the full and complete truth. There are times when it's not kind to tell someone the truth. If a 6-year-old asks where babies come from, we tailor our response to match her emotional and psychological development. We would provide a far more complete answer if she were 12. If a 22-year-old were to ask, we would be concerned, but if the 22-year-old were developmentally disabled, we would again tailor our response to accommodate his or her emotional development. But what happens when we do this for someone experiencing dementia? Someone who is losing their memory skills, but also their ability to use rational thought and to analyze. There are really only 2 possible outcomes. They might believe what we tell them is reality, but that means accepting that their own brains are leading them astray, and the emotional response to that realization is fear. And we should feel afraid if we realize that our brains are giving us bad information and have become unreliable. But more often, the outcome is disbelief. Usually when we correct someone who lacks rational thinking skills, they don't believe us because they're not able to compare their own version of reality with ours or perceive how ours is more likely to be true. And so they become angry. They think we're trying to mislead them or playing games with them. I believe that we as caregivers need to understand and accept that it is within our ability to shape the caregiving relationship, and that it is our responsibility as the ones who are not losing cognitive skills to accommodate our loved ones who are. We cannot change dementia. We can't cure it or treat it at present, but we can change the way we respond to those who have it. It's our approach that is within our control, and our approach will result in either more companionship or more conflict. How we respond to our companion's altered view of reality is the deciding factor in the caregiving relationship. We can either use correction, reality orientation, or we can accept their loss of skills and growing inability to accurately perceive reality and work around it. When we do this, we are being respectful. We are accepting their abilities and their disabilities, and we are being person-centered. I'm not saying that appropriate care and reality orientation are wrong. They have their place in other medical situations, such as the treatment of PTSD or mental illness or traumatic brain injury. I am saying that they don't work in dementia care, because people experiencing dementia are losing rational thought, and so they do not have the skills they would need to compare and analyze the validity of our differing version of reality. Reality orientation means to orient the person to time and place, correct their false beliefs, and tell them if they are responding to dreamed rather than real events. So imagine Mrs. Smith, who has dementia and lives in a care facility, who has just been woken up and asked to get ready for breakfast. She declines, saying that she already ate breakfast with her mother. The aide responds gently, but with reality orientation, telling her that no, that can't be true, for she lives in the facility. Her mother passed on years before, and it's 7 a.m. on a Tuesday morning. It's time for breakfast. What usually happens next? Usually, the person with dementia does not accept the correction. Their response is disbelief, and they refuse to cooperate. And when the aide insists, as she must, she has many people to get ready, the person becomes adamant, and if the aide tries to pull back the covers or begins to remove a piece of clothing, Mrs. Smith might then strike out or push her away. Now the situation has escalated to one of risk. Upset people may hurt themselves or staff or other residents, so the facility management must take action. Care has been refused. This is why we have such a high incidence of psychotropic drug use in care facilities in the United States. But drugging someone so that they are unable to refuse care is not care. the better approach. The only truly viable option is habilitative care. Rather than using the medical approach and responding to dementia as disease and behaviors as symptoms of disease, being habilitative means to focus on the person's needs. This requires that the caregiver first understand what the person's abilities are, as well as what skills they are losing or have lost. Knowing this, the caregiver can support what the person can do. When we accept the altered sense of reality that dementia creates and stop asking people to use memory and rational thinking skills to understand that their sense of reality has become skewed, we are being person-centered. We accept people who are experiencing dementia as they are and instead change our approach to accommodate them so that we can keep them safe and meet their needs. As you know, my work with people living at home with dementia here in Moscow, Idaho, I came to see a pattern in the skills that they lost and the skills they retained. It is not a medical pattern. It does not identify disease or symptoms. It's a set of functions, of abilities, skills we have at our disposal throughout our lives, some of which are lost in dementia. When we look at dementia from the perspective of skills, of functioning rather than disease, there is a roadmap. Families and caregivers can foresee how to move forward. We can tailor and create care plans that support dignity and autonomy, that maximize independence, and help people age in place. Person-centered care is not only kinder, but also the most reasonable and economical way to work with dementia. Person-centered care not only recognizes the changes to cognitive abilities that dementia causes, but also the emotional needs that are created when we experience cognitive decline. This is the dawn flower. It shows the 7 areas in which we need emotional support when we are experiencing dementia. The 7 tools of the dawn method correspond with these 7 emotional needs. In coming classes, we'll go through each need, and I'll share tools and techniques for meeting each. The reason we use the metaphor of a flower at dawn is because when we stop asking people to use skills they no longer have and meet their emotional needs, the care relationship really can become something of beauty. You really can regain companionship with your loved one who's experiencing dementia. So this is the roadmap for living and working with someone experiencing dementia. Dawn Care uses a habilitative approach, helping you learn how to recognize and support the changes to functioning and emotional needs that dementia will cause. So now you know why habilitative, or person-centered care, is so much more effective than the medical approach when we're working with dementia, and why reality orientation isn't successful. In our next class, we'll talk about another issue that comes up all too often in dementia care, the problem of people refusing care even when it's available and really necessary. Thank you.